Southwest Georgia, like many other rural areas in the state, it's often more greatly affected by health disparities. Our region's population carries higher burdens and rates of poverty, children in poverty, individuals feeling mental distress, and substantiated reports of child abuse and neglect when compared to the rest of the state, with significantly fewer resources available to them. While across the state of Georgia, there are mental health provider shortages, they are more pronounced in rural areas such as Southwest Georgia. Another barrier to care in rural areas is deficiency of access due to a lack of transportation, especially public transportation. Being anonymous and private can also be challenging in small communities. Last but not least, professional learning opportunities are not easily accessible to youth-serving organizations. The need in Southwest Georgia is immense for a more educated, engaged, and aware community on child's mental health, trauma-informed care practices, and resiliency initiatives for youth. Here at Vashti, we are committed to improving the lives of children and families in our community. Back in November 2019, Resilient Georgia, an organization based out of Atlanta, in partnership with the Potilik Foundation, created a statewide coalition to develop a closely aligned trauma-informed public and private network with a united vision to create a birth through 26-year-old integrated behavioral health system. This includes the use of essential tools such as education, teaching, training, workforce development, policy strengthening, practice research, and evaluation. I was a part of the second round of grantees awarded this grant in July of 2020 to regional coalitions based out of Albany, Columbus, Rome, and Thomasville and the surrounding counties. Vashti Center was chosen to provide a regional emphasis on trauma-informed awareness and care, adverse childhood experiences, better known as ACEs, and child sexual abuse prevention training as a basis to transform systems and procedures crossing both public and private sectors within our community. We do this with offering a variety of trainings to the community, and we can either come to your organization or we'll host them here at Vashti Center. Here at the Vashti Center, we have aimed to utilize a tri-focus approach for our mission to address health disparities affecting rural Southwest Georgia to develop more resiliency, increase awareness, and improve access to mental health. Our main areas of focus and goals have been to connect the youth-serving organizations across the 7 counties to develop and offer a strong collection of professional development and training opportunities focused on trauma-informed care, youth mental health, child abuse and prevention, and ACEs. Other goals include raising awareness through participating in Child Abuse Prevention Month and National Mental Health Awareness Month, through community events, social media campaigns, and screenings of relevant documentaries on these important topics. Through this effort, we look to reduce the stigma associated with mental health and trauma among the 7 counties. Vashti also offers advocacy efforts through education and in-service training to different civic clubs and community members on ACEs and trauma-informed care. We can't do all of this without your help. In order to become a more resilient community, we're asking you to join our collaboration by scheduling your training with us, you, your church, your organization, and become more educated about childhood trauma and how to respond to it. Help us build stronger families and communities in which children are safe, nurtured, and loved. Join the forces to heal trauma in our community by sharing what you've learned with your friends and colleagues, and joining Resilient Southwest Georgia in ending stigma surrounding mental health and behavioral health issues, because mental health matters and our children matter.